everybody, welcome to Kindest Regards Zeddy. Thank you so much for the love and support that you've been showing me. I really appreciate it. Today we're talking about something very close to my heart, mental health. We'll also just touch a bit on self-awareness, emotional intelligence, and to join me and to speak on a more professional perspective on this conversation, I've invited clinical psychologist Lerato Rasoasi. Let's get into it. So guys, as I said in the intro, I've invited clinical psychologist Lerato Rasoasi to come share on a professional perspective about mental health and emotional intelligence. Thank you so much for coming. How are you, Lerato?
I am well, thank you, and it's a pleasure to be here.
Lerato, what is mental health?
So mental health is an aspect of health holistically. So because there's health physically, and then there's like the mental part, and you can't have one without the other, right? So the mental part of it is the emotional component, emotional, more cognitive, emotional, but more emotional part of that. And it's not just that you're not sick, it's also you being well, it's you being able to manage your emotions, cope, grow, be insightful itself, interact with others as well.
Yes.
And it's not just about you, it's about a mentally well community, because you can't have like someone who is mentally well but everything around them is toxic. Then it's gonna definitely make them unwell as well.
So let's say someone is mentally unhealthy. What are some of the mental illnesses that it could possibly lead to? In some of the research that I did, there are some of the prominent ones. What are those?
Okay, so the prominent mental illnesses in the world and also in our country, according to WHO, which are the World Health Association or organization rather, are substance abuse is number one, unfortunately. Holistically in the world and in South Africa as well, and I think we saw that with the whole lockdown stuff and alcohol being banned, that people really struggle. So substance abuse is a big coping mechanism for a lot of people, and therefore it is number one. And then depression, anxiety, and then bipolar is also another one that's prominent, and maybe we can talk about personality disorders as well. So yeah, those are some of the prominent ones.
Okay, what are the triggers of some of these mental illnesses? Like what would trigger someone to get to have or bipolar or depression or abuse substances?
So I'll start with maybe just defining them, if we can do, and maybe we should just talk about substance abuse as well, because it basically it's when someone is dependent on substances. So it's not just alcohol, it could be a lot of people actually, it could be painkillers, caffeine, and then there are the harder drugs, cocaine, cat, marijuana, whatnot. So people then become dependent. So if you're dependent and you cannot function without the substance, then that would be a substance use disorder. Depression and bipolar are mood disorders.
Okay.
So they fall under one umbrella. So they're about a person who cannot manage and kind of like, kind of regulate their affect, which is their emotions. So sometimes because everybody feels sad.
Yes.
Everybody has moments where they feel sad, or excited, and just like you're just having this great week or whatever, or a great day. But if it's a more persistent pattern of affect, meaning mood, you're always that same mood, like for like 5 days, 2 weeks, this person has been in bed, windows shut, crying, not eating, depressed. So with depression, it's a unipolar mood disorder, meaning you only have the depressed side.
Okay.
With bipolar, so that's unipolar. And then with bipolar, you have two. You have the depression and the mania, which is the excited, happy, side. Okay, so when it comes to personality disorders, a personality disorder is defined as an entrenched pattern of being. I'm going to make an example with one of the personality disorders because there's a number of them. A dependent personality disorder is someone who is intrinsically just dependent dependent on people and other things, like, so they can't really cope and function without people and things. So they'll usually like be in a relationship and be dependent, no matter how bad the relationship is. They'll need things, whether they're work or whatever. And the thing that is prominent about personality disorders is that people who are diagnosed with a personality disorder will usually see them by the way they perceive things and the way they relate in relationships. Definitely relationships, they're always quite problematic. So they struggle with relationships. Either people describe them as very needy or turbulent or emotional or whatever. So that's essentially what personality disorders are about.
Okay. So with substance abuse, depression, bipolar, and personality disorder, what are the triggers of these prominent mental illnesses?
Yes. With personality disorders, because they're a very entrenched way of being, most of the time you just see it emerge as the person grows into their adulthood, especially when life stresses kind of increase, because when you're still young, things are still kind of easy, but when you get into like from adolescent into a young adulthood, then it's kind of, so I would say probably life stresses.
Okay. Sorry to cut you, could we say how you grew, your upbringing could have an influence on that?
Definitely.
Okay.
Definitely. So triggers and causes are different things. Cause is the root, it's like how it started, but the trigger is what makes it come up, even when it's dormant. What makes it come to the surface? So if we're talking about causes, there is a number of things. So we have this model where we talk about biopsychosocial. It's like biological, meaning internal chemical stuff, and then we have the social, and then we have also the emotional part. So if we're talking about mental illness in general, because it's so difficult to kind of like, there's a lot. So if I'm just gonna kind of generalize it, I will say that there's the emotional, there's the chemical imbalances. So we have chemical imbalances where if someone's depressed, their brain is not secreting enough dopamine and serotonin, and like when women are pregnant and when after they had children, their hormones are quite mixed up, and then they will be depressed. And also then the more social part of it will be the baby needing a lot from them, and that will be draining. So that's one of the things.
Substance abuse
is a huge broad one. Definitely also you think about it from a biopsychosocial. Mostly people will tend to look at it from a very social. There are some people who genetically kind of inherited, but a lot of the time it's more situational, it's more environmental, it's more stresses that are more environmental. And then with the mood disorders, definitely all three involved. Definitely the chemicals, you going through stuff and how you learned to manage your emotions and your thought patterns, and also the environment.
All right, with all of that, so let's say we've established that something's not okay. I've been triggered in some way or another, in the environment or inside of myself, or chemically a family member realizes that something's not okay. When is the right time to seek psychological help? And when we're seeking that psychological help and we're given, let's say, prescribed medication, how long would that treatment go on for? Is it lifetime or is it a period? Can you just elaborate on that?
Okay, great question. Firstly, if someone around you or yourself, you realize that maybe you're not okay mentally in terms of mental health and mental wellness, go see a psychologist or psychiatrist. You can start at the GP, but we recommend you go to a psychologist or psychiatrist. Because the psychiatrist is the medical doctor who will then prescribe medication, but they will do an assessment the way I would do it as well as a psychologist. Ask you questions, do the assessment. Then, if you are then diagnosed with a mental illness, I as a psychologist will not prescribe medication, that's not my role, but I will then refer you to a psychiatrist if I feel that you do need medication. So it's not everybody that has a mental illness that needs to be on medication. So for instance, people who are diagnosed with depression, for instance, can work through the depression through therapy. And we'll probably talk about what we do in therapy later. And then with stuff like more chemically orientated diseases like bipolar or schizophrenia or psychotic illness, definitely you need to see a psychiatrist. That person will then put you on medication, and how they will determine how long you're going to be on medication and what medication will be determined by their assessment of, you know, like how long you've been, you know, kind of psychotic or manic or whatever.
How severe
it is.
Okay.
And what are your then again the supportive factors around you? Do you have a supportive family environment? Do you have stresses? Do you have a job that stresses you? Then they can put you on a certain medication and they can try it out. They usually try it out 3 months, 6 months, and then we see. And sometimes people are on medication for just a year, maybe. You know, if someone is really struggling with depression, they're on medication for a year, and then they might not need it after that. They might be well again, and then things will go on, especially if they've lost someone or work changes. But with diseases like, with illnesses like bipolar, schizophrenia, psychotic disorders, most of the time it's life. You're on medication for life, which is a huge adjustment for people.
With society, there is a lot of stigma towards mental illnesses. Look, I think we've come far. It's no longer taboo conversation in society, but culturally sometimes, religiously sometimes, people are still a bit like, man, snap out of it. Crazy pills, happy pills. You can fix yourself. I mean, you're enough. You're complete. You can get out of this. From a psychological perspective, what is your take on that conversation and that stigma?
Yeah, I mean, stigma is something we deal with in mental health all year round, all the time. We have definitely come far, but it's still there because of cultural perspectives, because of religious perspectives. Like, no, it's because you're not going to church. You're not praying enough. Meanwhile, this person has a chemical imbalance. And I'm not saying that, you know, with people and religion and people's beliefs, I'm not saying that miracles are not possible and stuff like that, but like, you need to go to a doctor and sort out the chemical imbalance, right? So think about it. If you have diabetes and your body can't process your insulin properly, or if your leg is broken, if you're in a car accident, your leg broke, and are you going to be like, no, snap out of it, just walk, man, that muscle will come back? No, it won't. You have to go to the doctor.
Medical
help. You have to. The doctor needs to, you know, strengthen your muscle again. Needs to, maybe you need surgery, and then maybe you need pills that are gonna help you, and then maybe you need crutches. So I tend to say to my clients that you going to, for instance, if someone has work stress and they're really not coping at work and they've become depressed and stressed and anxious, I say, look, you don't have to be on medication forever. Go to the psychiatrist, get assessed. Maybe you need some crutches to go through this period. Maybe it's because of corona or it's a new job and things have been stressful. And then post that, you might feel better again. And then the doctor will start weaning off. So with anxiety, with depression and stuff like that, it's possible to either not even go on medication or to be on medication for a time frame and then get off. But with stuff like psychotic disorders, with bipolar, such illnesses are a little bit more chemically orientated, and they really do need a balancing of those chemicals for a lifetime most of the time.
Let's move on to self-awareness, also known as emotional intelligence. What is emotional intelligence?
So emotional intelligence, aka EQ, also known as EQ, is basically the ability to understand oneself emotionally. So the ability to understand yourself, ability to use and manage your emotions in a positive way, to be able to cope with life stresses, to be able to be productive with life at work, in your family, to be able to resolve conflict, just to navigate through life's, you know, kind of challenges.
Okay. So in an article that I read, the writer wrote, "I'm proposing the use of emotional intelligence and supporting strategies to help people with mental health. But this is no substitute for receiving actual medical advice and therapy." In a world of psychology, in the world of psychology, rather, Lerato, what does emotional intelligent self-awareness mean, and could it assist with mental health as this article is proposing?
Yes. So EQ is a huge part of the therapeutic and the healing part or the treatment of mental health and mental illness. So if you have a problem, whether it be in accounting or whatever, how do you attend to the problem if you don't understand it? How do you fix the machine or whatever if you don't understand what is in the machine and how it works? So that's why even with emotional and mental health, one needs to understand themselves and need to dig into things about themselves and understand triggers, understand, in order to resolve and kind of heal and, So, and I guess I should add to say, sometimes in therapy, people come and they don't necessarily they don't have a mental illness. They're not there to, they don't have a diagnosis and whatever, but they just want to enlighten themselves and understand themselves better. And yes, that can, because I think what this article was touching on was that it can be a protective factor to have good EQ.
Sorry.
It can be a protective factor to have good EQ because you're then more aware of self. You understand yourself. So if you have gotten a job and you had to move to Cape Town from Joburg and you get there, the weather sucks and like there's a lot of things. There's stress at work, you left your partner this side and your kids, and then you start feeling depressed and you're not concentrating at work and you're not eating. Then if you are someone who's very aware of yourself, you know yourself, you're able to quickly go, wait, something is not okay.
Okay, so with that being said, with emotional intelligence, we're not saying because you have emotional intelligence you cannot be mentally ill, and also the other way around, because you are mentally unhealthy or have mental illness, you have a low EQ.
No.
Okay.
No. By no means does it mean that if you are mentally ill, you can't have EQ, good EQ, or that if you've got good EQ or self-awareness that you can't have a mental illness, you can't fall mentally ill. It's not as simple as that. I'll use the example of the guy who is now in Cape Town. The job is showing him flames because it's just hectic, it's a new job, it's adjustment. There's also something called adjustment disorder. So it's adjustment, and then usilebana at home with wife, so he's lonely, so there's a lot going on, and then he just has like a bit of an episode of depression. He's more self-aware now, this guy, so he can easily like look within himself and say, no, I'm not sleeping, I'm not concentrating at work, something is not right?
Yeah,
because he's more self-aware. And then get help. But then if somebody has had a mental illness since they were 16, they've had persistent depressive disorder, but during that time, maybe when they were like 20 now, they started becoming self-aware, they started going to therapy, and then now they can develop their self-awareness. They can now, so they used to have minimal self-awareness, but they can increase it, they can grow it. They can now start to see the triggers, like when they're on the period, they tend to have lower, or when exam time comes, they can start to, so it's not as black and white.
Right. In closing, the stigma towards going to therapy, that you're crazy, you can't handle yourself. What do you, as a psychologist, when someone comes to you because they've been referred and said you need to see a psychiatrist, what do you say to them? And is it a way or form of them developing emotional EQ, attending therapy? Just a summary of therapy and
EQ.
And EQ and the stigma.
And the stigma as well.
Yeah.
Okay. So I will start with when someone is referred to myself or a psychiatrist, particularly to myself, sometimes they do come with that sense of like a stigma. Like they'll ask me like, does this mean I'm crazy? So people still have that idea that just seeing a therapist is about you being crazy or like you're not okay, you can't handle life, whatever. Meanwhile, sometimes Moto has been handling life, but something in life has happened. It's a big life stressor, and then now they're not coping. And then what we do in that sense, like I just said previously, then the goal of therapy then is to build EQ to EQ is like a muscle. You strengthen it, you build it. So we teach them skills about coping, about awareness, to know your triggers. How do you manage emotions when you're feeling that they're overwhelming?
Yes.
Because we all feel overwhelming sadness sometimes, but what is the difference between someone who can manage them and get through them and someone who will linger in them for days?
Tell us about you, Lerato, as a clinical psychologist. Where can people find you if they're seeking help? Yeah, tell us more about that.
Okay, so my name is, if you're going to be Googling me, my name is Lerato Rasoasi, clinical psychologist. So you just put all those words, Lerato Rasoasi, clinical psychologist, on Google. My website will then come up. I'm on Therapist Directory as well. I'm on Facebook and Instagram. I have pages there, so then I'll come up. So my practice is based in Sandton in Morningside, where I work with other psychologists as well, and that's where I see mostly adults. So I see usually young adults. I also see some people who are growing into young adulthood, so 17, 16, 19, 20. I don't see children at the moment. And yeah, if you're looking to get my services.
Thank you so much for joining us, and kindest regards, Zere. Definitely, I think this would need a more intricate conversation on the different mental illnesses and just going deeper into them, and hopefully in the future you'll be able to join us and just have that deeper conversation about the different mental illnesses. But otherwise, we appreciate your presence, and kindest regards, Zere. What an insightful conversation from someone who's personally suffered from mental illness. I think at this stage of the game, guys, we cannot have a stigma around mental illnesses. We can't be silent about it, and I'm really truly grateful that people have become more public about it, so that we don't sit in our corners and die internally on our own. But yeah, with that being said, I hope this was very helpful. Thank you so much for watching. Love and light. Please follow Kindest Regards on YouTube and Facebook, and Tanile_Dlamini on Instagram. God bless.